Okay, great. Hello, everyone, and welcome to AFSPA's 2023 annual meeting. We are glad to be offering this as a hybrid event for the first time since 2020. We met in person about a week before the mass closures started, at least here on the East Coast. And we're glad to be back with you again here in person, but also for those who are joining us virtually around the world. Thank you so much for tuning in. We want to invite those who are online to use the Q&A feature within the On24 platform. Submit your questions there. There will be multiple times for questions throughout the day, and we will do our best to balance questions here in the room with those that come through online. We've got 3 people monitoring those. Just a couple housekeeping items before we get started. For those of you in the room, in the event of an emergency, please proceed out the door over there, into the main corridor, past the elevators, and then turn right. There's a staircase there that leads down and exits on the first floor. Staff will be with you as well. For those online, in the event of any technical difficulties, and we've had these in recent hybrid events, please stand by. We do have staff outside of our office, throughout the DMV, and actually one staff member joining us from Guam just to cover our bases. And please stand by. They will keep you updated if we have any difficulties. As I mentioned, there will be various times throughout the meeting when we will have opportunities to ask questions, and for those of us on staff with AFSPA and some of our colleagues and partners to answer your questions. We'll do our best to balance questions. We will also do our best to make sure that if we can't answer it in the time being, we do have people, for those of you here in person, who can answer questions about various programs from FSBP to our ancillary insurance programs, Medicare Advantage, and more. And they'll be available during the breaks as well as after the meeting. I will ask for questions here in the room and also online. Please don't include any personal health or personal identifiable information when you submit those, as others may be able to see those questions. Now to our program. Before we get into today's agenda, I'm going to ask our chairman to share a few thoughts with you. And before I do, I'm going to want to make sure that everybody remembers exactly who Tom TRACY is and his time at AFSPA. He is the chairman of our board, and he is also retired from the Foreign Service. He joined the U.S. Foreign Service in 1960 and served in Mexico, New York, London, and Washington. Between 1973 and 1979, he served as the administrative officer at the American embassies in Brussels, Moscow, and Bonn. Mr. TRACY then spent 5 years as the Assistant Secretary of State for Administration, where he oversaw a bureau budget that exceeded $500 million annually and was responsible for worldwide operations, communications, and IT. Following his time at the Department of State, he went on to serve for 15 years as the Chief of Administration of the Pan American Health Organization. And following his retirement from PAHO, he worked as a contractor at the Department of State for a number of years and has been active on several boards. Notably, in addition to his service on the AFSPA board, Mr. TRACY is a member of the board and serves as the Secretary and Treasurer of the Senior Living Foundation of the American Foreign Service. Mr. TRACY received his BA in Political Science from Colgate University, his MA in History from Stanford University, and his MBA in Organization and Management from Columbia University. Mr. TRACY.
Thank you, Kyle. It's a great pleasure to be here this morning after 3 years. And we're obviously in a much better place with COVID than we were 3 years ago. But I would note that this COVID is still one of the top 10 killers of Americans today. My remarks are going to be fairly brief. I'm going to talk about a couple of long-term trends in the healthcare industry which affect us and which the organization is working to ameliorate. The first is there's consolidation across the board amongst healthcare providers. Doctors' practices are being either consolidated or sold to hospitals. Hospitals themselves are being sold into chains of hospitals, some with consolidation, some with closure. And the same thing is occurring in drugstores, as I'm sure you all know. The second issue, besides consolidation of healthcare providers, is the specialization that is occurring in the field of medicine itself. And that is the specialization, which is bringing us a great deal of progress on diseases like cancer, genetic conditions, and the like. It's an important step. But I'd also point out that specialization leads to stovepiping. And the healthcare industry is already stovepipe, so this is more stovepipes than before. So I think one of the roles of the association is to be your partner and help you to deal with this ever increasing complex healthcare system. And I point out that for some years we've had a number of programs dealing with chronic conditions such as high cholesterol, high glucose, high blood pressure. Those affect very large segments of our population. But those programs will continue. But we've also added a consulting service for complex and serious illnesses. And we're going to continue to work on these approaches, but we'd like the association to be your partner in good health and to give you the means and the ability to deal with it. So with that, I would just say thank you very much and for coming. We appreciate you taking the time from your schedule.
Thank you. Thank you very much, Mr. Tracy. And we have our charge. If we didn't already, we have it now for the years ahead. Well, looking a little closer to today and over the next few hours, we have a great meeting for you. And as we have it with past annual meetings, we'll begin with a look back at the year that's been. So we'll take a look at 2022, our results with our Foreign Service Benefit Plan, as well as our ancillary insurance programs, before we take a look ahead, not just at 2023, but the years beyond that. Following a break, we are fortunate to be able to welcome some of our partners to share information with you about programs designed to support our members in various needs. Leaders from Hinge Health will provide an overview of their remote exercise and physical therapy program. After that, some of the managers from our clinical health team at Aetna will give you an idea, an overview, and some examples of the clinical programs that are available to all members to help them in a number of different situations. And finally, after our second break, we will have time to explore the FSBP Aetna Medicare Advantage plan that we launched in January of this year. I have a feeling that session may be more questions than presentation, and we're ready for it. But with each of these, we will have limited time for questions and answers for our speakers, and at the end of the meeting, some general Q&A with our next speaker. And our next speaker is someone who probably for this group needs very little, if any, introduction, but I'm going to give one anyway. Paula Jacob is the Chief Executive Officer and the Executive Vice President of the American Foreign Service Protective Association. She provides all of us strategic leadership that facilitates the development and enhancement of various insurance and specialty programs, many of which you will hear about today. Paula also serves as the Executive Director of the Senior Living Foundation of the American Foreign Service, overseeing the charitable operations that provide more than $600,000 annually in grants to help elderly Foreign Service community members. Paula attended Creighton University in her hometown of Omaha, Nebraska, and has more than 40 years of experience in the insurance field. She is a registered health underwriter as designated by the National Association of Health Underwriters, now the National Association of Benefit and Insurance Professionals. And she's a formally recognized subject matter expert in federal health benefits by the Foreign Service Institute, where she serves on the adjunct faculty. Paula?
Thank you. Thank you very much. Can everybody hear me? Mic working? Okay, well, it is so good to see so many people here. I was very, very excited when I woke up this morning and said, oh my goodness, I'm going to be able to actually see the members. I remember, remember back in the day when we used to have this meeting in January? And we moved it due to the weather. Yeah. So, a few years back, we thought, we were going to do this. And then remember back when we had this beautiful meeting planned out and the federal government closed down because of a windstorm. And believe it or not, about 6 of you came anyway. Thank goodness that Kyle had donuts for you. And so the last time we were together was in 2020, 3 days before COVID shut everything down. I think this is maybe a bad omen. And now, okay, so we thought today and this beautiful weather that we're having. So thank you for coming out, even in this, what is going to be apparently an all-day rainstorm. Like I said, maybe it's an omen. We should probably be listening to it. However, I want to talk about what's been happening in the healthcare field and how the Foreign Service Benefit Plan is responding. So, open season, I really don't like a leash, so I'll be walking around. Open season was in November, December, and it was the first time that we were able in 3 years to actually go out and personally visit with members. So we were very happy about that. We actually attended 18 domestic in-person events. We visited 6 different countries, and they were very happy to have us back, we hope. We offered 15 different webinars, and Kyle and many of the team members got up for a 5 a.m. webinar and a midnight or 11 p.m. webinar because, as you know, the members are all over the place. So we had several hundred attended and registered, and we think that this was a really good opportunity for us to not only talk to the members, but more importantly than that, to listen to the members. So we were really, really happy to be able to get back in person. So what were the results of open season? Well, we have processed almost 3,000 transactions due to open season. We have received over 1,700 new enrollees. So we were really excited to have new members of our family. Our total enrollment is almost 40,000, which means that we are responsible every single day for the lives of almost 100,000 enrollees and family members, and we do not take that lightly. Back in 1988, those numbers were less than 12,000. So we're really, really fortunate to see that growth. Some of the statistics on operations, the plan paid almost $500 million, with a B, $500 million in claims last year. Over 1,600,000 claims. And almost 70% of those were filed electronically, which is a really good way to get the claim process more quickly than snail mail. Aetna has done a really great job. The operational results of that, over 99% of those processing was, we had a 99.75% processing accuracy. 85% were processed within 15 calendar days, and 93% of those overseas, including those that needed to be translated, were processed in 21 days. And I think that's really amazing. So we are really, really proud of that. As far as our member services go, we handled over 65,000 inquiries, member calls last year. And our average speed of answer throughout the entire year was 7 seconds. Now, for some of you, you're saying that can't be true because I know I waited, for 2 or 3 minutes, and I will acknowledge that. But on average, somebody picked up the phone in 7 seconds. Our answering speed of answer for email was 3 business days, and we really do every day. The team that picks up the phone, answers your calls, every day they really do try to provide you with the excellent service that you deserve. They are very passionate. What I call them is passionate and compassionate at the same time. As far as our prescription drugs, which is a big part of the benefits that we provide, we processed over 1 million different prescriptions last year, and it was about 50-50. Most of them were at retail, but about half of them were actually at mail. Now, the plan paid over $90 million in just prescriptions alone. and the plan pays about 89, almost 90% of your prescription costs. And by the way, this is really one of the highest, if not the highest, in the entire FEHB program. Occasionally we get dinged by OPM about the cost share amount between us and the member, but we try to really keep it as high as they will allow us to do. So we're real proud of that. Okay, what's going on in healthcare? Well, telehealth, as you know, is really a big, big deal. Thank goodness for telehealth in 2020. We had been providing telehealth for a very, very long time, but it really expanded in 2020. More than last year, actually, we had more than 108,000 visits on telehealth, both domestically and overseas as well. And what do you think the number one condition was for telehealth? Behavioral health, mental wellness. Yeah. And imagine what would have happened if the plan did not have that resource for our members, not just domestically, but overseas as well. So we're really, really happy with those results. What do we want to do? Well, one of our major things is we want to bring healthcare closer to all of our members. We use things like smart healthcare devices. Whether you're looking at the Livongo with the device for high blood pressure or diabetes, we do continuing wellness programs through those connected devices. We really like to explore the in-home programs that we can offer. And one of those, of course, is Hinge Health, which is the help with the virtual in-home physical therapy benefit that we have. And you'll hear more about that from one of our speakers. But we also like to do things like, in 2020, when COVID hit, everything locked down, right? And those with cancer had a really bigger challenge because they needed to get their infusions. They were scared to get out, everything was closed. So what did we do? We worked with our partners at both AETNA and Express Scripts through Accredo, and we did everything we could where it was feasible to send a nurse into the home to give those infusions. And I think, this is an important benefit, and this is where I really think healthcare is going. What can we do as a health plan to make it easier and more adaptable to your needs? I talked about telehealth and telemedicine, and that is not going away anytime soon. And we're glad to expand that as well. Our focus has always been, when is it the right time and what intervention is right for you as an individual? Not just as a number, not just as a group, but as an individual. And we really do try to develop the right programs for each and every individual. Things like care management. And I'm going to go through these very quickly because you will hear a lot more about the care management programs through one of our guest speakers. But one-on-one continuous support is really, really important. Things that when your doctor says something and you're not quite sure you heard it right, or you don't understand it, or you have questions, who do you call? I mean, I don't think that the doctor's going to answer at 8 o'clock at night, right? But you have the support through our care management program to help answer those questions, and including social work program, compassionate care, things to plan for, cancer support, a specific group that is available to you for cancer support. Talked a little bit about the Livongo system. That is one of our most popular programs. Also Hinge Health, and they'll be online to talk about their program, but also things like what Mr. Tracy was saying about the independent second opinion. Medicine is really, really complicated and complex. And as good as a physician is, it is impossible for that physician to keep up to date. Technology and treatment programs and standards are changing, not monthly, but daily. So where do you turn? I mean, if the doctor can't keep up with it, where do you go? Well, where you go is to us. What does that mean? We have a relationship with Pinnacle Care, which is an independent second opinion. I myself, if you've read my newsletters, I myself use these people for a serious illness, and they got me through it. They got me to the major provider in the area that could handle it. And I'm great. I'm fine. I feel better than I felt in 10 years. And it was all because of this plan offered an extensive program that could help with getting me to the right medical team at the right time. So please remember that you have access to that at no charge to you. Overseas, we also have a very special program with the folks at Cleveland Clinic, of course, one of the premier medical systems in the entire country, if not the world, because things are different overseas. I don't have to tell you that, right? And what do you do if you're going to a local doctor and they say, well, here, you have to do this? Well, really? Are you sure about that? Well, again, who do you turn to? You turn to us, so that we can get you into providers that can give you a second opinion through review of the notes and the lab tests and everything else. And that has really worked well. And let me tell you, the Bureau of Medical Services now loves this program and loves that we do that. You're going to hear a lot about lifestyle and condition coaching. This is how do we keep you as well as we can get you? And how do we keep you there? Because like it or not, we're all going to have something at some time. We're all going to have a chronic condition. And where do we turn? Well, we have tons of coaching programs that, once again, you'll hear in much more detail about. So we really do want to be a health plan and not just one that pays your claims. I think we're doing a pretty good job. I hope we are. This is our theme for this year. In 2020, in January, not in March, but in January, we had this great idea that we were going to look at mental wellness and how it affects one's physical health. Could not have come at a better time because it was really, people really took a hit. But we decided to turn that a little bit this year and really look at how physical health relates to mental wellness and really look at what we can do, take a holistic approach to each individual. So you'll see that we're wrapping the programs around not just your mental wellness, but also your physical health. So really, I encourage everybody to look at what programs we offer, talk to our partners out there, and use us. That's what we're here for. All right. So next, don't forget that we actually pay you to do this in a way. We have a really robust wellness program. I call it Simple Steps to Living Well Together. You can actually earn up to $400 per year per individual in just doing things that you know you need to do. Getting your flu shot, getting your boosters, things like that, doing the mammogram, stuff like that. And it really does help because that stuff, putting it in your wellness account, you can pull it for things that we don't pay for, like dental expenses. You know, we have really low dental benefits, so I'm being recorded. Things like that. So really think about what can I do? What are the benefits on this wellness program here? And we'll have people out there that will help you go through that and see how you can use those wellness benefits. Some important tidbits that I think is really, really important to remind you of, because I want to leave plenty of time for the important people to talk about the programs we offer. You heard about the No Surprise Billing Act last year. It was finally signed into law beginning last year, and everybody thought it was going to take care of everything, right? And there would be no more problems with billing. Well, yes and no. But I want to remind you that the No Surprise Billing Act applies to certain things. It applies to if you are in an in-network facility and you are seen by an out-of-network provider. You know, you're in the hospital and you see this person come in and they introduce themselves as a hospitalist. I didn't even know what that was. And then all of a sudden said, and they ask, how you doing? And you say, oh, I'm okay. Well, I'm glad to hear that. And they leave and you get a bill for $300. Well, I can't do that anymore, right? That is what the No Surprises Act is. It does not provide that protection if you decide to go to an out-of-network provider on your own. Things like that. That's not what it covers. So really be careful with that. Just a reminder. Another reminder, and I really harp on this, is the HIPAA 3 form. This is a form that is required under the law that we have to have on file. Us or any other health plan has to have on file in order for us to talk to somebody that you say. Even if it's your spouse. If we do not have that HIPAA form on file, we cannot talk to your spouse about anything about you, or your daughter, or your sister, whatever. So please make sure that you have it. If we don't, or you can provide a power of attorney, but believe me, the HIPAA 3 form is one form. It's very simple. Sign it, make sure we have it, and you're good to go. And I also want to just take a little bit about a little brief about long-term care insurance. Not much, but the long-term care market, as many of you might have read, is in absolute flux right now. I mean, considering that the federal long-term care insurance program, how many have the federal long-term care insurance program? Okay, well, you're fine, but they've actually suspended that program. They've suspended it, no changes, no new people, not even new hires can go into this program yet. Now, hopefully they're going to kind of regroup and come up with a new product in 2024 or whatever. But right now that entire program is suspended. So you can look for increases when they finally do decide to come up with something. So why do I talk about this? Because there's a lot going on in the long-term care market, not just long-term care insurance market, but just the aging of America. People are using the benefit, right? Unlike life insurance that goes away when you're 70 or 75 or 80, long-term care doesn't do that. And people are keeping their long-term care policies. And now, with the aging of America, people are using their long-term care insurance policies. And I'll tell you about Medicaid, right? Medicaid is being stretched, like stretched, and it's going to really pop. So they're looking at things. Many states are actually requiring long-term care insurance, or the individual is going to have to pay a payroll tax. Starts in Washington in June of this year, and there's about 16 or 17 other states that are looking at this. That's not the biggest thing. The biggest thing is caregiver burnout. If you've ever been there, right, you know what you're talking about. And so the whole long-term care, healthcare industry is in flux. So it's really, really important to make sure that you're protected. So what does AFSPA do about that? Well, we quit selling long-term care insurance many, many years ago. And the reason is because there's so many, the good news is there's so many good long-term care insurance policies out there. The bad news is that there's so many good long-term care insurance policies out there, and one size does not fit all. But what we have is a long-term care consultant. And what is really important about this is that these are professionals who are licensed and certified, who can not only talk to you about your long-term care needs, but also if you already have long-term care insurance, they can look at what you have and make sure that you are adequately covered. That is a service that is actually free to AFSPA members. So I encourage you to take advantage of that as well. Okay, next up is just a little reminder that the Foreign Service Benefit Plan is not the only thing that we do here, although it is by far the biggest thing that we do here. But we have 3 different life insurance plans, 4 dental plans, 2 disability plans, members of household for those who are bringing their parents or their domestic partner, whomever overseas, legal services, retirement planning, travel, and also financial planning and tax consultants. Lots of out there. Adrian, can you raise your hand, is in charge of our ancillary insurance programs, and she's happy to talk to anybody about what we offer afterwards. Also want to take a couple minutes to talk about our discount care programs. Now, this is what I call the what if programs. I don't know of one person who really enjoys writing that dental insurance premium every quarter, right? Where you may or may not need it, or paying for the vision insurance that you may or may not need. So these discount programs is what I call for what ifs. Well, I have healthy teeth, and not me, but somebody might. And what if I have a cavity? I don't want to pay that whole premium, right? But these are discount programs that are lower in cost, and you know exactly what your out-of-pocket's going to be. Members really, really like this, both dental and vision and LASIK discount programs. And we also have a True Hearing program. True Hearing has been a huge success with our members because you can actually combine the savings you get through the True Hearing program with the benefits that you get through your foreign service benefit plan. And I caution you, they last year, I guess it was, they came out with their big advertisement on over-the-counter hearing aids. Do you remember that? You're fed. And what I remind you is, you're fed, you have really good insurance. Don't settle. Make sure that you get the right type of hearing aid. And it is an actual hearing aid as opposed to some of these over-the-counter hearing amplifiers. So use the benefit that you have. Okay, what are we looking at for 2023? I talked about what we did last year. I talked about some of the things that we are looking at now. Let's talk about 2023 and beyond. We monitor all of these constantly. I'm not going to go through this, but like Tom said, the consolidation of healthcare. We need to be big enough that we can have a seat at the table when you're looking at these big hospitals and providers that are coming together. Coordination of care is a really big thing as well. And continuity of care is also very, very important. New treatment and options and breakthrough therapies. And this is where it's heading. And this is what we are looking at for not just this year, next year, 2025, 2026. These are all the new current gene and cell therapies in the pipeline. And they are terrific. You would never have dreamed that there would actually be a cure for hemophilia. Who would have thought that? Or sickle cell. But here it comes. Now, we had our first gene therapy claim last year. We've paid probably 3 claims this year so far, and we've approved another 3 or 4 claims. Why is this important? Because it's only 3 claims, right? Here's the cost of those claims. So when you are looking how great it is to be able to cure something like hemophilia, that price tag is $2.5 million. And now not everybody has it. Very few people are going to have it, which sounds, okay, we can handle that. But when you're looking at bladder cancer, that is supposed to have come out last year, I think it will come out this year, this gene therapy for bladder cancer, that's $300,000 per year. So the health plans are looking at, well, how do we provide these great programs and services that can save lives and still stay afloat? So for 2024 and 2025 and 2026, this is what we're looking at, is how do we deal with the new technology that's coming out? It's great. And is it worth it? Well, if it's your life, yeah, it is worth it, right? So we will make sure that we are covered, and you are covered with this. Not a lot of changes on Medicare. Britt is going to talk about the new Medicare Advantage program. It's no big changes. As I've said, and many of you have attended my seminars at FSI, and I always say, it's an individual decision. Many of you have Part B, many of you don't. and that is a really real individual decisions. We have done a lot of podcasts and a lot of information on our website as far as the pros and cons of Medicare. The brand new Medicare Advantage plans have come out in the federal program, started to show their face about 3 years ago, 4 years ago maybe. We kind of waited to see, actually, we waited to see the other people's mistakes so we would not make them. I am very happy about the Medicare Advantage plan that we've developed for the Foreign Service. And Britt's going to talk a lot more about it. But I want to say it's not for everybody, which is why it's voluntary. And it's also voluntary. You can go, if you decide that, gee, this sounds pretty good, you don't have to wait till open season. You can sign up for it now. So we've tried to make it really flexible, and Britt will talk a little bit about that. Like Tom said, we do want to be partners in your health, and we really, really try to develop programs and services around your needs, whether they are you're perfectly well and you just need things like your physical exam and things like that, or even you want to keep healthy. We even have a fitness tracker as one of our wellness benefits in our Living Well Together program. To your chronic conditions, whether it's high blood pressure, diabetes, heart things that we all know we're going to have, but how do we keep you at that level? Instead, so that you're not going into the complex level. And we also have programs for those complex people too. So we really do try to develop a variety of programs and services for you. So the last thing I want to talk about before I turn it over is the Senior Living Foundation. One of my favorite things to talk about. Happy birthday to us. The Senior Living Foundation is 35 years old this year. Time flies when you're having fun, right? This, of course, is the charitable arm. As many of you know who you are. We thank you very much for what you do that allows us to do what we do. We provide resource center, and Kate is out there. There she is. Kate is our social worker who is basically in charge of the whole thing. So we thank you very much, Kate. But this has been, as you well know, a tremendous success, not just for the retirees, but also since 2018, to our active duty colleagues who are dealing with their parents. And we are able to provide guidance for them. So when they are in Botswana, they're not worrying about that because they know we got it. We got you. And that has been a huge success too. We held our Planning for Change seminar in 2022. Information about that, and the recording is on our website if you're interested in that. Tons of great information. Last year, our grants exceeded $650,000. That's how much we gave away, $650,000. We couldn't have done it without you. And I want to end with a story. So this is just one example of what the foundation does. So AFSPA, our colleague and partner, referred this retiree to us in 2018. This widow was in a retiree community that she couldn't afford. Rent kept going up and up. And of course, she struggled with the death of her husband, and thus her annuity went down to 55%. So if they were struggling before, this woman was really struggling. So we got our social worker to review her financial documentation, and she was eligible for assistance from the foundation. So after a year of communicating with this widow and her son and daughter-in-law, who were wanting to help, but had troubles of their own, we got the widow to move into a better community. But she's still having financial issues. So we established a grant. It started out at $500 to subsidize that rent, monthly rent. We continued to increase the grant as the cost rose. 2 years later, she deteriorated. She ended up having to move from a retirement community to assisted living. And we increased the grant once again. Cognitively, she declined, and her finances declined to where she was eligible for Medicaid, so we backed off, except for the support for the case manager support. And this case manager developed a wonderful relationship with her and her family, saw the widow 2 or 3 times a month to check in, to answer questions. Last year in December, the son experienced a major medical event. So the case manager worked with where the son was and was able to have the mother visit him to assure her that he was going to be okay. So just after the first of the year, she was surrounded by her son and her daughter-in-law and this case manager with whom she developed a really close relationship, and she passed away quietly with all of those people around her. So over the last 3.5 years, this widow remained in a really safe, comfortable environment, friendly faces, friendly voices, and that's thanks to you. So I leave this with, once the Senior Living Foundation makes a commitment, that commitment is lifelong, and I want to personally thank you for letting us do what we do. So thank you for everything that you allow the foundation to do. And with that, I do want to recognize one of our foundation board members here, Ambassador Skip Ganin. Did I do okay with that story, Ambassador? Okay. Okay. Thank you very much.
Right.
Kyle?
Thank you, Paula. And I'd also like to recognize 2 of our other AFSPA board members who are here. Chuck McCarter and Dave Witten are also with us today. And we are at the end of our first section of the meeting. And there will be time to ask Paula some questions later. We'll get to that at the end of the meeting. But for now, we have a 10-minute break. There will be a counter on the screen counting down to our return. So we'll be back in 10 minutes. Stretch, hydrate, and we'll see you soon. And we're back from break. So I'll ask everybody here in the room to go ahead and take a seat. And those of you joining us online, welcome back. Thank you for your patience. And this year, I should say in past years, we've typically done a single keynote speaker who's focused on one major program that we think it would be beneficial to members. And this year, rather than a single keynote speaker, we wanted to share some information about many of our programs. So, hold on just a second. There we go. We're going to try it again. Is that better? Okay. All right. I'll start again. Sorry about that, everybody. Thank you for joining us again. I was just saying, rather than a single keynote speaker, we're having multiple speakers this year to give us a chance to explore a number of programs that are available to our members and to meet various needs. Some are very popular, while some of these other programs you'll hear about today are frankly underutilized. So we're glad to spread the news about it. All of them are effective and help bring healthcare closer to you. First up, we wanted to share some information about a program which has been the source of many unprompted emails, I know what you're thinking, but of thanks and praise. Our favorite emails that Paul and I get, we'll take those. And that's been the case since we launched the program in 2021. The program is Hinge Health. Our speakers are joining us remotely today, and I'm going to hand it off now to Kevin Davis to introduce himself and his colleague. Kevin?
Perfect. Thank you, Kyle. And if there are any audio issues, just let me know. Perfect. Well, good afternoon, everyone, and thank you for having us. Really feel privileged to be here with you all today. So my name is Kevin Davis, and I lead our client success team at Hinge Health. My team and I partner with clients such as AFSPA to make sure that we're all set up for success long term. Joining me today is Dr. Claire Morrow, our physical therapy consultant manager at Hinge Health. Dr. Claire has been practicing physical therapy for about 10 years now. She's a board-certified orthopedic clinical specialist and fellow of the American Academy of Orthopedic Manual. Dr. Claire Morrow, our physical therapy. We are delighted to be here today to tell you more about MSK and Hinge Health. She's a board-certified orthopedic clinical specialist and fellow of the. So in our short time together, we will be talking about some of the challenges we face with traditional MSK care. We'll share a bit about how Hinge Health Health is addressing those challenges and gaps, and how we're making MSK care more accessible, including our plans for international expansion, which we'll touch on here in a few minutes. And finally, we'd love to share some of the incredible results and outcomes specific to Foreign Service Benefit Plan. I will now pass it over to Dr. Claire, who will tell us more about MSK from a clinical point of view.
Yeah, hi everyone. My name is Claire Morrow, and just like Kevin, let me know if there are any audio issues. As Kevin mentioned, I've been practicing physical therapy for around 10 years, and our awareness of what drives musculoskeletal pain and how to treat it has really evolved during those 10 years. So there are a number of risk factors for developing either acute pain or long-term pain. And a lot of these risk factors are much more complex than simply a physical injury or a physical cause of pain. But of course, there can be onsets of pain from somebody that has a physically demanding job or a sedentary job. So somebody who's sitting at their desk, can also develop some low back pain, neck pain, just like somebody who is lifting or on their feet all day. So repetitive, sustained, awkward postures can also include a risk factor for pain, and then excessive force to the body. But we like to think about thinking about all of the factors that can help to improve somebody's resilience with all of these factors. So additionally, there can be other factors. So things like poor nutrition, a lack of an appropriate fitness routine, poor hydration, even poor rest can increase your risk factor of developing an MSK injury. And so really we're starting to learn that pain is more complex, as I mentioned. So we understand that there's a tremendous financial burden when somebody is going through chronic pain. So on average, it's about $8,000 to $12,000 per year that is burdened and sustained by a plan, with things including physical therapy, prescription drugs, missed work, and even surgery to help manage some of these conditions. And oftentimes, things that are more invasive, like surgery or injections, can be avoided when it comes to managing chronic pain. We know that over 50% of people with pain report suboptimal sleep. And I think anybody that has gone through an episode of low back pain or neck pain can attest to that for sure. There's a huge emotional toll when we're talking about chronic pain. So individuals with pain for over 6 months are 4 times as likely to be depressed. And then, of course, in our new world, those of us that are working from home, that have a little bit more of that sedentary lifestyle, and maybe not the most optimal work setup at home, we've been noticing an increase in pain as well with those individuals. But what's interesting is that when you look at all of those things are not just factors that can predispose you to pain. We know that depression, that somebody with pain for more than 6 months is more likely to be depressed, but the opposite is true also. So somebody struggling with depression is also more likely to have a hard time recovering from an episode of low back pain. Somebody who doesn't sleep well is more likely to have a hard time recovering from an injury. And so it really becomes the cyclical factor when we're thinking about managing somebody who has had even a recent injury or a chronic pain condition. We can't just consider that physical cause of pain. We need to really consider that whole person. We already mentioned earlier in this meeting behavioral health and whole well-being, and that's really our approach at Hinge Health. So at Hinge Health, we recognize that we're not just managing the entire person, but we're also managing different aspects of somebody depending on where they are in the spectrum of experiencing pain. So whether you don't have any pain right now, but you just want to build up healthy habits and learn about pain management strategies, exercises, education around ergonomics or exercise that can help prevent an injury or prevent an onset of pain, or whether you actually have had a recent injury. So, whether you were shoveling snow and injured your back or sprained your ankle over the weekend, we have a specific program to help you manage that, to help you recover quickly and reduce the incidence of that becoming a chronic condition. And then we also have our flagship program, which is for somebody who has been struggling with chronic joint or muscle pain. So somebody who has been struggling with maybe on and off low back pain for years, chronic hip pain for 1 to 2 years, neck pain, all things like that, even conditions like knee arthritis, we can help to manage this with our chronic condition. And so we really think about centering that relief around you. And the way that we do this is that we make sure that our solution is simple. We make sure that it's easy to access. We also make sure that it's clinically complete to meet all of your needs. So we help to address more than just the physical cause of pain. And then we personalize it so that individuals are getting the right care at the right time. So let's dive into each of those now. So simple access means that you have access to the Hinge Health app from your device of choice. So you can download the Hinge Health app and do the entire program on your own device. We also give you the option for us to mail you a tablet so that you can also experience the program on a tablet. We don't want technology to be a barrier. Our physical therapists are able to meet with you via a video visit. They also are in our app. So for every exercise in our app, you're able to watch a video of a physical therapist demonstrating the exercise, even demonstrating modifications. You're able to follow along the exercises in the app so that you're doing the correct repetitions, you're doing the form correctly. So it's much more simple than following along a sheet of paper with pictures and thinking, well, I think I'm doing the exercises correctly. And then additionally, our app helps you to set goals and stay on track. We build gamification into the app so you generate points as you do exercises. You're able to set reminders in the app so that you know to do your exercises on the days and the times that you choose. And so it really is simple to stay on track with this program. Versus, maybe a traditional physical therapy program where you see your PT, you get some instructions, and then you don't see them again for 1 to 2 weeks. Let's talk about now how it is complete. So when you join our program, you'll partner with a physical therapist and a health coach. The PT will tailor the exercises that are part of your program. They'll also recommend pain management strategies for you. Whereas the health coach will be contacting you multiple times per week. Typically, that's via text messaging, although you can opt to email or talk to your health coach over the phone. And the health coach is there to help you with some of those lifestyle factors that we mentioned earlier. So setting goals around things like nutrition or, sleep hygiene can be really helpful when you're trying to stay on track with an exercise program to manage your pain. We also have physicians on staff. Our chief medical officer is a practicing physical medicine and rehabilitation doctor. And then we also have orthopedic surgeons who can help you with guidance, for example, if you're considering surgery for a condition. And then, as I mentioned, that unlimited one-on-one health coaching. Additionally, if you're having some trouble with some of the technology, we actually have 24/7 support so that, if your sensors aren't pairing, if you need to charge your tablet, something like that, you're able to talk to somebody about that 24/7. Our physical therapists really do personalize the plan for you. Additionally, we have AI built into our platform so that as you're doing the exercises are even being personalized in the moment. You can change where your target zone is, for example, so the range of motion that you're doing in an exercise. And then we can even recommend those changes while you're doing the exercises. Based on the information that we learn from you in your application questionnaire that you fill out prior to joining, and also the information that you give us while you're in the program, we continually personalize the program to meet your needs. And so a little bit about how you can get started. So you would discover Hinge Health through the landing page that is specific to AFSPA. Then you would fill out a questionnaire. So you would complete a application screener where you tell us a little bit about yourself. Tell us about what your pain is like. Where is your pain? How bad is it? You'll fill out some outcome measures so that we can track your progress. And then in the same day, once you're accepted, you're able to download the Hinge Health app. You're able to schedule a video visit with your physical therapist. And we give you exercises and education based on the information that we learned in your application so that you're able to actually start moving and recovering that same day. We don't want scheduling or having to mail you a kit to be a barrier to getting started. And so I will actually pass it to Kevin now, and he's going to talk to you about our international expansion now.
Perfect. Thank you, Claire. And I see a lot of good questions coming through, which we'll be able to address here in just a couple of minutes. So first of all, just wanted to give everyone just a little bit of a preview into what's ahead for our international expansion plans, knowing how important that is to AFSPA and the Foreign Service Benefit Plan. So we are committed to making sure Foreign Service Benefit Plan members get the care they need. And I'm excited to share that we'll be offering our chronic pathway to members in Canada starting at the end of this year. And then we plan to expand to the UK in 2024. And then we'll be evaluating the EU, Australia, Mexico, and India as our next international expansion plans. We're excited about the opportunity to provide simple access to complete muscle and joint care to Foreign Service Benefit Plan members over the coming years. And now I would just like to spend about a minute or two going through some of the great results that we've seen since we've been working together. So in 2022, we've engaged over 1,100 members, Foreign Service Benefit Plan members. And it's not just that people are signing up and engaging, but they really enjoy the program. We're seeing a high satisfaction rate at 8.9 out of 10. Engagement and satisfaction are inherently connected. Members likely won't engage enough to see results if they don't enjoy the program. So we put a really high premium on providing an exceptional member experience. And it's really paying off. Foreign Service Benefit Plan members are seeing a 53% reduction in pain, a 67% reduction in depression, and a 72% reduction in anxiety. So engagement, satisfaction, and outcomes are all linked together. And on top of these results, we've also reduced the likelihood of surgery by 74%. This data shows us that the Hinge Health program is truly helping Foreign Service Benefit Plan members move past their pain, and we're looking forward to helping even more members this year. Just wanted to share a few user testimonials. These are direct quotes from Foreign Service Benefit Plan members who have participated in the Hinge Health program to date. I won't read these all word for word. You can see them on the screen here. I do want to call out just a couple of things here, though. On the first quote, "I'm very glad I can work as if I were years younger." That's a really powerful statement to make there, because our programs, when you're in chronic pain all the time, it does impact so many aspects of your life, whether it's personal or professional. So we always love seeing the impact on overall productivity that our programs can have. The second quote, I really like the quote around, "I'm very happy with the program and my progress. I've increased energy and improved mood." And those were both goals that this individual had. And that's really part of the program, where everyone has different goals. And our program is designed to really equip people to address their conditions and achieve the goals they set out at the beginning. And then lastly, someone who's gone on multiple hikes over the course of a weekend. I don't do multiple, but sometimes I'll go on one hike, and just seeing that they're able to get back to those activities that they weren't able to in the past because of their MSK conditions. So you can see we haven't only helped people reduce their pain, but also really help set the foundation for a healthier lifestyle. I just want to thank you again for having us. Thank you again for your time. And we will open it up to questions now. And I believe Kyle will be facilitating the Q&A.
Online, and we'll have opportunities for those in the room to ask. But Kevin and Claire, we had a question. is a referral from a doctor required to access Hinge Health services? I know you shared a demonstration of how the how one can use the app. And I'm getting a message here from Kevin. His Wi-Fi went out, and Claire was wondering what happened to us. We turned the microphone off for a response. So we were just mentioning that a doctor's referral is not required. And Claire, if you're there, we had a question. Are some of the features new? Someone did Hinge Health back in 2021, but they did not have access to a physical therapist, just videos of the exercises and a health coach. So are some of these features improvements over the last year and a half since this person participated?
Yeah, great question. And the answer is yes. So one of our projects over the last year and a half has been to add physical therapists and videos into the app for all of the exercises, and also have physical therapists available to do video visits with members in all of the programs, whether you're having a new injury or whether you're managing a chronic pain condition. And so, yes, these are improvements. And so, you know, we really strive to continually improve our product and the experience for our members. Good question.
Question about, can Hinge Health help with people who are experiencing balance issues?
Yes, I love this question, actually. I'm so happy to answer this. So I think a couple of answers. First, yes, you know, if you are enrolled in a program like our knee or hip program, anytime you're doing the exercises where you're strengthening that lower extremity, then that will help with balance. But additionally, one of the new programs that we are launching this year, I mentioned that we are always trying to improve our program, is a dedicated balance and falls prevention program. So specifically to help individuals improve their balance. We will be launching that this year. So I'm so happy that you asked that question.
Great. And one last question, and that was, is it possible, or have you all considered making it possible for someone participating in the program to participate so that they can target more than one part of their body? So maybe shoulder and knee.
Yes, and that is, again, another improvement that we are implementing now. So right now, if you are enrolled in our low back program, for example, and then you start to also have pain in your shoulder, our PT will be able to insert shoulder exercises into your program. So we'll be able to help you to manage that condition. Look for these capabilities to continue to improve over the next year and actually be able to enroll concurrently in multiple programs. So being able to tell us right during your application questionnaire if you're having areas of concern for multiple body parts. Yes, we're able to manage that over the next year and actually be able to.
All right. And Claire and Kevin, thank you all very much for joining us today and helping us learn a little bit more about Hinge Health. For members who are interested, you can go and learn more at hingehealth.com/FSBP for Foreign Service Benefit Plan. There's an intake survey there, as well as some demonstrations similar to what we saw today. So thank you all very much for joining us. The adjustments, I want to introduce Britt. She may be familiar to many of you. She's been working on the plan since 2009. She is today our dedicated manager of account services, but after graduating Clemson, she did join the Aetna customer service team in 2009, spent a year there before being promoted to client advocate, which is where was working on some of our toughest issues that came up in member communications, claims, and things like that. In 2016, she was promoted to the account management team, and she's been serving us in that capacity. She is my go-to person, and so today, your go-to person for any issues with Aetna and design issues with some of our programs, as well as any questions about claims and how things may be processed and implementation of new programs. But today, she's putting on a different hat, and that is as an expert presenter, I should say, on our FSBP Aetna Medicare Advantage plan that we launched in January. And we've got your slides ready.
Perfect. I was about to say good morning, but good afternoon, everyone. It's good to be here. We get a lot of questions about the Foreign Service Benefit Plan, Medicare Advantage plan. A lot of you probably see commercials on TV about Medicare Advantage plans. This plan is nothing like those plans. This plan is designed for members, Foreign Service Benefit Plan members that have Medicare A and B and are retired. If you choose Paula alluded to this earlier, you can choose to opt in at any time. If you choose to elect this plan, it works similar to how if you have Medicare A and B today and as primary and then your foreign service as secondary, you still have the same zero cost sharing for your deductibles, co-payments, and co-insurance that you have. But with this, you also get additional enhanced benefits. You get up to $900 per year in Part B premium reductions. We've added several programs such as Silver Sneakers. That's one that a lot of people have requested. And under the Foreign Service Benefit Plan, we can't offer that program. But under the Advantage Plan, we can because it is governed by the Centers of Medicare and Medicaid Services. You also get home health visits. I'll go into a little bit more detail about that later. Low prescription copays, as low as $0 if you go to a preferred pharmacy for generic and $2 for standard pharmacies for generic. You still get the unlimited chiropractic services. Additional benefit is instead of the $125 of combined PT, physical therapy, occupational therapy, and speech therapy, you have unlimited visits for that. We also cover acupuncture, and you have a nationwide of providers. Something that's different under this plan is under the Foreign Service Plan, you don't get a routine vision exam. Under the Medicare Advantage, you do. And there's also different dental benefits. Under the Medicare Advantage, it's 100% for preventative with no deductibles. And then for any type of comprehensive kind of problematic, it's $25 deductible and then 50% of that. Next slide, please. Thanks. Some of the additional wellness programs, you still have access to Teladoc. That's your free virtual care provider where you can log online, get an appointment very quickly. I know a struggle has been some people getting appointments with their doctors, so you can log into that still and have access to that. You also have non-emergency transportation. If you're not able to get to your doctor's appointments, we can provide transportation and get you to and from those. I mentioned Silver Sneakers. That's good for your, having exercise classes, a social activity, and they also do some online exercise programs through them as well. The meal benefit program, that's an additional benefit. If you're inpatient and you come home, we want to make sure you have the resources you need. So we'll mail meals to your home, up to 14 meals that you have, that nutrition when you get home. We also have the hearing aid reimbursement and resources for living. That's a really great program. This is resources that members may need in their daily life. Finding a contractor to do work on your house, research, senior housing and adult daycare, a list of senior centers in your area where they have activities going on. So that's another resource through the AETNA Advantage, the FSBP AETNA Advantage program. That's okay. Now it all sounds like a great program, but there are differences. When you have Medicare A and B now with the Foreign Service Benefit Plan, we don't require prior authorization for you. You go to your doctor, they say you need this surgery, you don't have to call us. Medicare approves it, we approve it. But under the Medicare Advantage Plan, there are some services that require prior authorization where your doctor would need to call in and make sure they're approved before you have the services, such as inpatient hospital, outpatient care, physical therapy, skilled nursing care, and massage therapy. This is a big difference. If you use your massage therapy benefits under the FSBP Aetna Medicare Advantage Plan, it is a lot different. They must be medically necessary. You can't go have a massage for comfort or relaxation under this program. You have to go through ASH, which is a vendor program. You can use in or out of network, but ASH does have a program and a network of providers, and your provider must have to accept Medicare or the Aetna Advantage Plan. So if you utilize that benefit and you like just being able to go where you want to go, get your $60, this may not be the plan for you to enroll in. Another big difference is the pharmacy is under the Aetna Advantage Plan is through CVS and not Express Scripts. And so they do have different formulary lists. So if you take prescriptions, you would want to look at what your formulary is on the ESI side and how it compares to the CVS side and see if the tiers are different. And I hate to say this one, but your customer service is not handled by AFSPA either. It's handled by licensed Medicare reps through AETNA that are dedicated to this plan. And a lot of that is because you do have the CMS rules and governance that apply. So you have to have those licensures to make sure we're in compliance with CMS. So as Paula mentioned, you can opt in at any time. If you opt in and you don't like it, there's no questions asked. You call us, tell us you want to disenroll, submit the form, and you're done. You're back in the FSBP plan with your original Medicare. We have all of our information on this website, fsbphelp.com/retiree. There's enrollment links. There's provider directories. You can use any provider that accepts Medicare or Advantage plans, but if you need help finding a provider, there's links there. We have frequently asked questions, the formulary list for you to compare, and then of course our number to our dedicated Aetna Retiree Service Center that you can contact Monday through Friday, 8 a.m. to 8 p.m. Eastern Time.
Britt, thank you very much. As anticipated, we have some questions. In fact, I received some by email even before the annual meeting. We go back to the provider question. You mentioned that somebody who's enrolled in the Medicare Advantage plan can go to any provider that accepts Medicare. What if the provider says, wait a minute, I don't deal with this Medicare Advantage plan? What's the member's next step?
So I would call into the retiree center because a lot of providers get confused with the fee Medicare Advantage plans because it's not your typical commercial plan. And we've seen a lot of providers where they may be confused. And once one of our reps talk to them, they say, oh yeah, we do accept that. So that would be my first step, is to call the customer service number.
Okay. And I've had some questions about dental coverage under the Medicare Advantage plan. I know it has some preventive services,
Yes.
right? Can you talk a little bit more about how that works? Does somebody have to go to a dentist who accepts Medicare? Or can they just go to any dentist and submit a claim like they do with the Foreign Service Benefit Plan high option? How does the dental benefits work?
Yeah, so you can go to any dentist. You just would submit those claims, make sure it has the codes and everything on there. Like you said, we do pay 100% preventative. And then we do have the $25 deductible for your problematic issues, and then we pay 50%.
Okay, great. And we're going to talk, we've had some talk from Paula earlier about the wellness incentives under the Foreign Service Benefit Plan. And you mentioned there's some similar program under the Medicare Advantage. Yep. Can you talk a little bit more about sort of what those steps are to earn those incentives, how someone might claim them?
Yep. So it's called the Healthy Rewards Program. You don't earn money, you do earn gift cards under this program. Some of the actions you can take are just filling out a form and giving us your information. You get a gift card. Then you can do a home health visit where someone will come into your home and, check things out, talk to you, make sure you have the resources that you need. You can earn a gift card for that. There's a diabetes management one on there. So there's different activities you can take and earn those wellness incentives.
Great. Are hearing aids covered under this Medicare?
They are.
All right. And is the benefit any different?
It's the same.
All right. Great. I think that is welcome news to some of the questions we've gotten on online. And then there was a question, and I think you touched on this, about how the premium reduction works. So does someone have to fill out a form and send it in to get the $75 a month? How does that work?
No, it's automatic. So however you pay your premiums, that you'll be credited back that way, that $75 a month.
Excellent. And we've got a few more minutes. Are there any questions about this program from those here in the room?
Yes.
So to clarify, there is no additional premium cost beyond Part. There is no additional premium cost beyond Part B.
And your foreign service premium. No.
Yeah.
The only.
Yeah. I was going to say the only thing is the means testing and the IRMA law. So if you do pay, you may pay extra for that.
Right.
And you may want to speak more to that, Kyle.
Sure. So So you could run into, when you enroll in the Medicare Advantage plan, you're also enrolling in a Part D plan. Is that right?
Yes.
That's how the prescription drug benefits come through. And so if you're someone who pays more for your Part B coverage than the base rate of $163 and some change per month, you may see an additional premium charged, withheld from your Social Security or taken out of your bank account for the Part D. And I'm happy we can talk some more through that during the break or after the meeting, just to show what that might look like, so you have full understanding. That starts at about $12 and some change a month but that's, again, if you meet the means testing, you may see an additional premium for the Part D.
I've not attended to these programs very much since I retired. And so I just took the Foreign Service Benefit Plan as my primary my only insurance. And so I know that Medicare is out there. And people ask me if I'm on Medicare, and I said, no, I'm not on Medicare. I don't know why I should be or shouldn't be. I don't know what Medicare Advantage would do for me. And so I need an overview of what would help a person make the main decision on which of these plans to carry.
Absolutely. And we have someone here who can help you with just that during the break and after the meeting. Mr. Larry Neufeld is there in the doorway. He'll be at a table in the break room. And it is a personal decision when it comes to whether or not to enroll in Part B. Most people have premium-free Part A, but when it comes to Part B, it's a personal decision. It has to do with how much you'll be paying for premium, your tolerance for risk, your tolerance for paperwork, how much you're willing to pay out of pocket. There's a lot of different factors there. After that, because you must be enrolled in Part B.
Yes.
For the Medicare Advantage plan. After that, whether you want to enroll in the Medicare Advantage plan or not is another consideration. And we've tried to lay out sort of the pros and cons of that, what you're gaining and what you might be losing. Did have a question about massage therapy from folks online, so I appreciate you covering that. So it's a personal, it is really a personal decision. But Larry can talk you through some of the initial pieces and provide follow-up. And that goes for everybody here and those online. We can fill up Larry's inbox and he will get back with you. But he's been working on the plan for 50 years?
51 years in the FEHB, 35 years with the Foreign Service.
Got it. 35 years with us, but over 50 years on FEHB plans. So he knows this stuff. He's happy to answer it. Paul and I are also here to answer questions, but Larry's your guy today. Any other questions about the Medicare Advantage program? All right. Britt will be around throughout the meeting and in the break room. For those who have questions, we'll be watching for questions online. But for now, we're going to go into our final break, and we'll have, hopefully, one more presentation afterward and then some time for general question and answer. So we'll see you back in about 10 minutes. Thank you, everybody. Good to go? All right. Thank you, everybody. Thank you. The break ended up being a little bit longer than we anticipated, and I appreciate your patience both here and online. We are still experiencing some technical challenges getting Darla and Megan connected. So Britt and I are going to walk through some of the clinical programs. As I mentioned, Britt's been working on the plan since 2009. This, when I mentioned earlier, we've got, and so she knows the programs inside and out. That's the point. But I also want to mention, earlier I said we're going to learn about some programs that are quite popular, well-known, and we're also going to learn about some programs that are underutilized. And that's where we are now. Some of these clinical programs are underutilized because some members don't know that you can access them at any time, particularly members who may have Medicare Part B primary. They may not know that some of these services are available to them, but members may have to take the action themselves to connect. So, Britt, let me ask first of all, how do members get connected to our clinical team for care support?
So there's many ways you can call our clinical team directly. You may be going in for surgery and your doctor calls in for a pre-cert. We'll reach out to you at that point as well. Maybe we send an outreach letter to you because we've identified something and we want you to contact us so that we can help provide resources. Also, if you call our 24-hour nurse line that's available to all the members, when you talk to that nurse, they send our clinical care managers a referral so that we can connect with you to make sure you got the support you needed. And also some other ways are through some of the vendor programs that AFSPA offers.
Yeah, you may get a referral from some of our partners, including Hinge Health. Yep. Or some of the Livongo
Express
or
Scripts.
Absolutely. So things are much better connected than they were even just 5 years ago in terms of sharing information.
Yes.
Now, Britt, we talked about Darla and Megan before. Both of them are nurses. You mentioned nurse care managers, but is the team just nurses?
No, there's a lot of other specialties on our team. We have a social worker that can help provide and find you local resources. Say you're having trouble paying a bill, or you need help with your prescription co-payment, or need someone to build a ramp on your house. They'll help you find those resources. We also have a registered dietitian. We have a behavioral health specialist that can help support you and refer you to our dedicated behavioral health team. So we have a lot of other resources on that team besides just nurses.
And that dedicated behavioral health team is really fantastic. They're helping members every day, and are able to help members of all ages, not just people who are of working age, but they're able to help families who may be facing a diagnosis for their child, maybe of autism or other conditions, and all the way up into our later years. They've got support and resources available, and that team's available anytime to our members. Now, are we talking about, we've sort of touched on this, just incidents of care? So maybe I'm facing a new diagnosis, or maybe I'm scheduled for joint replacement surgery or something like that. Is that the only time, or is there support that's available sort of for ongoing chronic conditions?
There's support available for ongoing. And if you have any questions too, you can call our clinical team about any health condition.
Well, and we mentioned other programs. Paula alluded earlier to our lifestyle and condition coaching program that offers a number of options. And I wonder if you can expound on that a little bit. Is it just individual coaching? Is it still just telephonic? Are there a lot of options, a lot of ways to connect?
There's a lot of options through the lifestyle and condition coaching. We have one-on-one coaching, so you can work with one coach if you want to. It can be telephonically. They can email you, text you. We also have group coaching if you're okay going into a group setting and discussing different health conditions. So there's a lot of options for that as well. And it's expanded. We've expanded on the conditions. It's not just like your weight management, stress. They also work with children, can help you support your child if your child has a medical condition that you need support on.
Yeah, and that group counseling can really, both of us, we were talking last night about challenges we have with our children. Having somebody to talk about can be a real boost
Yes.
when you're going through those challenging times. So, you mentioned a pharmacist as part of the team, and for our members, we think about Express Scripts as our pharmacy benefit manager. What role can the pharmacist on the clinical team at Aetna play?
It's not to replace what you have through Express Scripts. It's just to support you, making sure you're getting the right medications, looking at things like that, supporting Express Scripts. If they reach out because maybe they can't reach you, they can reach out to our clinical team. We can help, try to bridge that gap as well. So just another pharmacist resource for the team.
Okay. And the coaching options and some other programs we have offer support for dietary and nutritional needs. But you mentioned that there's a nutritionist on the care management team. What role might that person play?
So there's various roles. Say you have a new diagnosis and you want to know how you can change your eating habits, to improve that condition. They can talk to you about that. Any lifestyle changes, if you want to make a lifestyle change, they're available for that as well. But a lot of it is condition-based, where they can provide support on that condition as well.
Okay. Now, I've referred members to the clinical team, to our support team many times. And one of the things that I think is important for members to understand, we can talk a little bit about the journey here, is let's say somebody is having a joint replacement surgery. Maybe it's knee, maybe it's hip. When might they contact the care team for the most support? Would it be after they're home from the hospital, when they're scheduling the surgery? What's best?
As soon as there's potential for you to have that surgery, you can reach out to us and we can help coordinate that care for you. Kind of take you out of the middle so you don't have to do all the legwork and stuff like that. We can make sure it gets approved. If we need to work on any discharge planning with the provider, we can coordinate all of that for you. So as soon as you know something's coming up, it's best to go ahead and reach out to us then.
Yeah, and I think that's an important thing to keep in mind, because this is when I've referred people. They called and said, I'm having hip surgery in 2 days and I've got to come home, and I live in a walk-up townhouse. What am I going to do? My bedroom's upstairs. How am I going to get around? And within hours, they were connected. They had answers to a hospital bed, to PT at home, things like that were covered. And that is really where the care management team can come in and help coordinate those details from the beginning. The other thing I should mention is they can also refer you to programs for support for pain management.
Yes.
This is another great program that we offer. Hinge Health is part of that pain management program, but when you're looking at post-surgical pain management, a lot of times the doctor is writing you a script. it's for fewer days than it used to be, but they're writing you a script for an opioid. And our team can help with that, and they can connect to programs. Is that
Yes.
right?
Yep.
And what about, you mentioned the social worker briefly, and they can connect to sort of community resources. And I think we've actually got multiple social workers on the team now, to my recollection.
Yes.
Yeah. And are there other reasons somebody might reach out, or is it for resources in the community or support?
Resource in the
see?
community, if you need to help filling out paperwork, different things like that, to get this support, that social worker can help you with that.
Excellent. And I just want to, we walked through a lot of the things that you all are seeing on your screen right now, but I want to touch specifically on cancer support, because we've got a lot of options and a lot of support that's available for members here. And I think that'll actually take us to our next screen. We want to hit on here, if we can advance the slide. And we have care navigators for things like gender affirming care and oncology. Can you talk a little bit about what role those people play?
Right. So these two positions are relatively new, but this is so that when you call in, you have one person that you have to tell your story to. And then they reach out to if you need help with a care manager, they'll reach out and coordinate that care. If you need help getting a referral to someone, or getting, your doctor needs, you need something approved, they'll help get those medical records and stuff. But you have one point of contact on your journey that can support you through that. And also, if a caregiver wants to talk to that person, they can talk to that caregiver and, provide guidance and resources to them as well.
And these are people who, this is all they do. They
Yes.
focus on supporting cancer
Yes.
patients, and they know our benefits. They know the programs that we offer and some of the programs that are offered through Express Scripts to help with nutrition during cancer treatment, things like that. So there's a lot of support available, and this is sort of a one-stop shop to get the information that you need.
Yes.
Okay. Now, a couple of the other programs that we've touched on throughout the meeting today that we just wanted to put in front of you again, because they are not necessarily part of our Aetna clinical team, but they coordinate, as Britt mentioned before, with our Aetna clinical team. And one of those is the 24-hour nurse line. And Britt, you mentioned this before. Could you expand on that just a little bit, why someone might utilize that?
Sure. So I actually use it through my insurance, the 24-hour nurse line. You can call, say you started having a cough. You don't know if you should go right away to the urgent care. Do you need to go to the ER? What's going on? And that nurse will walk you through that, talk to you, ask you what your symptoms are, and then help you navigate where you should get care. And so that's and provide resources to you. If it's something that, may not be that urgent, she can provide guidance, obviously not to treat you, but to provide guidance on how you can ease the symptoms, those types of things. And then, like I said, once you speak with that nurse, a referral is made to our care management team, and they will reach out to you just to make sure everything's good and you got what you needed.
Excellent. We also offer telehealth, and this is something that we actually started offering in 2017, I think, and we saw maybe 200, 300 claims a year prior to March 2020. And then we saw an increase of 2,000%
Right.
Per month over month, year over year. And so we're glad to have that. Our partnership is with Teladoc. Mm-hmm. And stateside, there's sort of four main categories of care that our members can access while receiving care in the United States. Can you review those?
Yeah, so if it's for your minor illnesses, and it's zero cost to you. They can also prescribe prescriptions, but you have your doctors of medicine, you have dermatologists, behavioral health specialists, psychiatrists. All of those are available through Teladoc. And I know a common theme that I've heard is that you can't get in with your doctor, or you have to wait 3 months to be seen.
Or can't find a doctor.
Or can't find a doctor, or somebody's not accepting new patients. So this is an easy way for you to start that journey and get care by registering for Teladoc and getting online. And and like I said, it's no cost to you to start that process.
And we've also recently started offering access to registered dietitians as well. And overseas, it's a Teladoc company, but we promote it as V Health.
Right.
And that's a little bit different because they can't always, the providers can't always write prescriptions everywhere in the world. Consultations are available.
Right.
But prescriptions may not be. And what about the behavioral health program there? Is that available overseas as well?
Yes. So we offer general medicine and behavioral health consultations for overseas. And if they are able to write prescriptions, they will. It's just a lot of countries have restrictions and we have to abide by those rules.
All right. And I'll ask my colleagues who are furiously managing 3 different screens. We'll get that cleared up. But Britt, we've done 2 years ago, I think, more than 2 years ago, we did some podcasts on My Strength and Able To. And those are programs that we've been offering to members for a while. Can you talk a little bit about what My Strength is and is a behavioral health support tool?
Yes, a behavioral health support tool for adolescents. It's an online program, so you can take it at your own pace. And it's just really a mental health resource for teens to get them the care that they need, the resources that they need. And it's something where they might feel better doing something online on their own versus speaking to someone. So giving them that avenue to get help as well.
Yeah, we started offering this because care for children and teens, virtual care is a whole a lot of times. We do have a partnership with a group called Brightline that provides that, but My Strength is something that's on the phone. They can use it at their own pace, as Britt said. It is available to adults, but we see people of all ages using it. It's a real a tool that sort of meets teenagers where they are as well. And then Able To is a little bit different. I should mention My Strength is available worldwide, but Able To is available only in the United States, and it's different. It's not just an app. There is a person there.
No. So Able To is for you where you may go through a major life event. Say you lost a spouse, you got a new diagnosis of cancer or something like that, and you want that additional support. So you can go through a program with Able To, and it's also no cost to the members, and you get to work with a provider, but also a coach. So they kind of work together to provide like a kind of a care plan for you over those to kind of help you navigate that major life event that just happened.
Absolutely. And I'll just mention, our dedicated care management team is a great first stop for any of these resources. If you're not sure where to go, if you're not sure what programs are available, they can help you. We are not directing care. We're not saying go to this doctor, but we're saying maybe here's some providers in your area, here's some options, including online virtual options that are available to you wherever you are in the world. And this team, many of the members of this dedicated team have been working on Foreign Service Benefit Plan for decades. And they are dedicated. They understand our members. They've walked through challenges with them and more. So please reach out to them. The last thing I want to touch on, and I missed this on the last slide, is the Compassionate Care Program. And this is something that we've introduced, and it may be of use to our members for themselves. It may also be used to our members for a loved one they're caring for. Can you talk a little bit more about that?
Yeah, so this program is to help you prepare for the end of life and providing you the support that you need during that, and help you make sure you have the things like your will. Make sure all those documents are in place so that your loved ones aren't left to have to do that. So it's just another resource just to help you navigate through those difficult times.
All right. And we will be available. We're happy to take questions now. And I see we got a question in the back row. I'm going to come back with the microphone.
Thank you, Kyle, for another excellent presentation. My question is, how do we access or where do we find the number to call for the 24-hour nurse line?
Sure. Look on the back of your ID card, and there is a number there for the 24-hour nurse advice line. That's also the number you use for the emergency translation line. If you're outside the U.S. in an emergency medical situation, need translation, it's one option versus the other once you connect, but that's how you connect to it. Yes, Mr. Hunt.
Thank you. Very impressive to hear about the management team here. I'm just curious. Last year, I had hip replacement surgery. Now, my internist referred me to an orthopedic surgeon. He wrote the prescriptions. He recommended therapy before and then after. I went to a PT facility. Everything worked very smoothly. I never heard of this care management. I mean, have I missed out on something? Everything seemed to work very well as it was. what is offered that might be in addition to that, if necessary?
This is great, and I'm glad that that works so smoothly for you. And you had a doctor who was in your corner to get the PT not just after your surgery, but also before. That's I think a best practice that I've heard that others have run into. So, if you have Medicare Part B, you don't have to go through a pre-certification process for surgery for it. So we wouldn't know that till we get the claim long after you've had the surgery. What you miss out, it doesn't sound like you missed out on anything. What you might have found is perhaps a referral to other programs, to at least a nurse care manager who you could call. You've got a question, not sure, is this a reaction to the medication, something like that? Somebody to call about that. But it sounds like you've had a great experience. But those are the sorts of things, if you didn't have that coordination, if you didn't have such a conscientious provider, that's where our care management team can come in and say, let's get you signed up for things. They can even do the outreach to the providers.
Right.
To make sure that the paperwork's in place, make sure if there's a prescription needed or referral, anything like that, that's where they can play that key role. Yes, ma'am.
So Kyle, I've become a little confused. At the moment, I have Medicare Part B and the Foreign Service Benefit Plan. And you've said with Medicare Part B, you don't need pre-certification, but sometimes with you all, you do, because I've explored cataract surgery and I was told I needed pre-certification from both of you, from Medicare Part B and from Foreign Service Benefit Plan. So I don't know if you can clarify. Am I just stupid?
No, not at all.
Absolutely not.
So,
absolutely. You've been in the front row for every annual meeting we've had, so I know that's not the case.
So what we've seen, and I don't know if this is specific to your case, but this plan obviously has great benefits. They cover premium intraocular lenses that a lot of insurances do not cover. So a lot of providers will ask, call in and say, are you sure you cover this? Because no one else covers it. And before they'll, give you the premium lens, they'll call us, but we don't require pre-cert for it. So I don't know how that came into play, but that's what we see a lot.
We can talk afterward. Medicare Part B typically does not require.
Thank you.
Yeah, absolutely. Thank you for the question. And I'll be looking over some of the questions online. Britt, I think you're off the hook now. Thank you very much for stepping in. I will take the other microphone. And I believe we have some time for some general Q&A. As we finish up for Paula and I to answer, but Paula, calling you, you can stay there. Leave me out here in the lines that, we promised some time at the end for general Q&A about AFSPA programs, and we're happy to do that now. I'm going to, came up unprepared. I'm going to go grab my computer. And actually, I'm going to give this microphone to Monique because she may have some questions for us online as well. So are there any questions here in the room? Monique can come around with the microphone, and we'll do our best.
Hi, this is basically and I've asked this question several years ago, so just whenever there might be an update. This is the phenomenon here in the DC area where you have a significant number of providers who will not accept Medicare. Mm-hmm. And then therefore the impact on the benefits on the beneficiary.
Right. So this is a good point because there are certain areas where we're finding more and more providers. So I want to talk real quick for everybody. Primer, 3 types of providers with Medicare. There are those who participate in Medicare. They accept assignment, which means they accept what Medicare says is the accepted amount. There are those who are considered, it's a misleading term here in a minute, non-participating, and they can charge up to 115% of the Medicare allowance. They hit what's called the limiting charge. And there are those third providers who are, and I think this is what you're talking about, opt-out providers. And these are providers or private contract providers. These are providers who say, nope, they make you sign a private contract. I, the doctor, am not going to bill Medicare, and you can't bill Medicare. And when you have Part B and the Foreign Service Benefit Plan, the only thing that we can pay, and this is an FEHB regulation, the only thing that we can pay is what we would have paid if they accept a Medicare, which is usually about 20% of the Medicare amount. Now, for those who don't have Part B, we'll still pay our benefits per the brochure. We would pay 90%, generally speaking, outpatient services for participating providers in the AETNA network, 70% of the plan allowance for providers who are outside the network. It is a challenge. More doctors are going this way. Some are going to concierge services. They may still participate in the network, but there's a fee, an annual fee, and we have tried. We've looked at it a number of different ways. The concierge fee, that annual fee, is not something that's covered by the plan. So this is something we're watching. We are constantly, and Britt can attest to this because we check with her at least quarterly, constantly looking for new providers to bring into the network, particularly in the behavioral health area. This is one place where nationwide fewer and fewer providers are graduating with degrees and gaining the credentials to provide behavioral health, and fewer participating in any network. So this is something we're absolutely aware of, but when it comes to Part B, our hands are tied a little bit by the regulations in terms of what we can pay.
I just had a follow-on to that. So that's one thing if you're eligible for and enrolled in Part B, but say you're still in the age, say, for example, you continue working past 65 and you don't have to take Part B just yet. So how would that then impact you once you turn 65 and you're only taking FEHB and not
and maybe Part A?
Yeah.
Yep. Then the benefits per the plan brochure remain the same. You have some additional protections that are in there because of OBRA, the bill that passed back in '93 that provides protections. But essentially the benefits that are listed in the brochure for outpatient services that are not covered by Medicare Part A, that's typically inpatient hospitalization, those are covered the same as the brochure, still in network, still out of network, the same benefits as listed. And you may have more success here. You may find providers who are participating in the network but have opted out of Medicare. And I should be clear, if you go to a doctor who is non-participating with Medicare, they can charge up to 115% of the Medicare approved amount. We will pay that extra 15%. We'll pay the typical 20% co-payment and co-insurance, I should say, and that additional 15% up to the limiting charge. But again, so if you decide not to enroll in Part B, you've still got us. You still have catastrophic out-of-pocket protection each year per the terms of the brochure. Right now, it's $5,000 for individuals when you go in network. So you still have protections. Some people enroll in Part B so that they're virtually 100% covered. They don't want the risk of having high out-of-pocket costs. FSBP, you still have protections, as with any federal plan, but with FSBP, we've kept that limit the same since we had to introduce it back in 2014. It's an Affordable Care Act requirement, but we've kept that amount the same, $5,000 for individuals in network, $7,000 for family in network. Monique's coming around with the microphone.
There's a fourth level that you didn't mention. Calling around for services, oftentimes on the outgoing message that you have to go to before you can leave your message or speak to a person, it says, the doctor is not accepting Medicare and Medicaid patients, new Medicare and new Medicaid patients at this time. So if you could get the appointment, it would be great that you would pay their extra 15%, but a lot of them have another level of screening, not accepting new Medicare and Medicaid patients at this time. My late brother, who was a doctor, said he would see a Medicare or Medicaid patient for free if it was humanitarian, but he would never, ever, ever subject himself to what amounted to a tax audit to take one patient. And so he would never, ever, ever accept Medicare or Medicaid. You'd see him free before you do that. And I never want to have Medicare during my lifetime because I don't want, we called 20 OBGYNs. We arrived in Washington. My wife got pregnant within a matter of days that she'd been trying, but her old OBGYN in California couldn't help her anymore. And we called 20 or 25, and mostly you couldn't even talk to the receptionist. As soon as mostly they weren't taking new patients, period. Mm-hmm. Please don't get pregnant. And most of them threw in gratuitously. It wasn't our case, but I made a mental note of it because I knew the decision was coming down the road. And the doctor is not taking new Medicare or new Medicaid patients at this time. So you might as well just hang up and not leave a message.
So, and the decision of how to participate, non-participate, or opt out of Medicare is, of course, a decision that individual providers make, and not something that we have control over. We do work on our network to include them in the network, and make sure that we've got adequate provider networks nationwide. And so I'll put that out there. I will also mention in terms of where it comes down to whether or not providers are accepting new patients. You can find that in the provider search tool linked through our website. That information is on there. There's also information on there about whether or not providers will participate in telemedicine. And you can actually filter by that if you're looking for somebody particularly, we see this a lot in mental health, behavioral health needs, that you can filter for that, find someone who participates in telemedicine, and that's available. Any other questions here in the room?
I have a non-medical question.
Yes, sir.
I was curious, what can AFSPA do for my wife when I drop dead? Can she be, you be a source of counseling for telling her what she has to do, what's needed to go on?
It's a question about information following the passing of an annuitant or active employee, and where someone, a survivor, can turn for that information. We can provide guidance and information about what office to contact, whether it's State Department for Foreign Service retirees, or of course the employing office if you're an active employee, or OPM, the Civil Service Retirement Office, and what forms will be needed. If you're Foreign Service retiree, Kate actually takes most of those calls when they come in. This is something that we see a lot with the Senior Living Foundation, is providing that guidance. We also see sometimes recent widows who find themselves in challenging times while waiting for the survivor annuity. Had a lot of those cases last year. So we are happy to provide that information and the connection of the office. And for Foreign Service retirees and survivors, that's what the foundation's about, is providing that resource. All right. Of course, my computer battery died just as I got up here. So I don't have all the questions online, but actually, there was a question about, is AFSPA looking at fertility benefits? And this was one of the things we were really happy to launch in 2023, was coverage for ART procedures, assisted reproductive technology, therapies, procedures. So things like artificial insemination, in vitro fertilization, and so forth. It's a limited benefit this year, but we were the only fee-for-service, national fee-for-service plan to offer anything. OPM opened the door and we kicked it open. Well, now OPM wants everybody else to come through, and I think we can share what we're looking at for. Okay, so just double check. All right, so OPM just this week published what they call their call letter, and this is the guidance they send to all FEHB carriers each year to say, this is what we want to see from you for the next year. And we incorporate this in the rate filing. They will be requiring all plans in the FEHB program to cover artificial insemination and prescription drugs that go along with artificial insemination, as well as drugs that support up to 3 rounds of in vitro fertilization each year. So we'll be looking at that. There are some other things that they're putting in place. They're encouraging plans to look at affinity groups and so forth. We are covering in vitro fertilization, as well as artificial insemination and drugs that go along with those, up to the cap that we've set. But we'll be looking at this. We'll be looking at the opportunity OPM has provided for us to re-examine our benefits and possibly expand them next year. But we literally just got this information on Wednesday night. So we are meeting Britt and Kelly, from Kelly O'Connell from Express Scripts heard about this last night. So we'll be talking more about it. We can't reveal anything. We've got to go through a process with OPM, but we are looking at ways to further support our members' needs across the board, and especially in this area next year. Do we have, yes, I'm sorry, one more question here in the room.
My wife's forcing me to ask this question. Yes. I went to look about my eyes, cataracts, recently, two providers, and I heard her question. Mm-hmm. And in both cases, they said they can restore your vision after the cataract, but they can restore it to perfect vision for $2,000 to $4,000 per eye, and that is not covered by insurance. Are you aware of that?
So there There, this is what Britt was referring to before. There is and then the phrase is escaping me. Britt had it before. That's what we're going to say, the premium intraocular lens. Intraocular, with an RA, not an ER, lens. And this is something that Britt mentioned, not a lot of insurance companies cover. And so oftentimes that's why the provider may say, oh, you've got to pay out of pocket. Guess what? We cover it. Now, the provider may not believe you. The provider may even say, you've got to pay out of pocket, send us the claim. We are covering it. And I will encourage you, we have 2 health benefits available to speak with in-person attendees afterward. They'll be available. Talk to one of them. They can walk you through exactly what that process looks like and how to go about getting that reimbursement. But that is exactly, if you can have better vision, that's fantastic. And we're trying to, again, looking at meeting your needs across the boards. And this is one of the ways that we're trying to do it. We're about 5 minutes left, and I'm just going to ask my colleagues, any questions popping up online that we should, Monique?
Yes, we have one. It says, does the FSBP Medicare Advantage plan cover me when I travel overseas and need to see a health provider in Asia or Europe?
Such a good question. So if you didn't hear, does the FSBP Aetna Medicare Advantage plan provide coverage overseas? And the answer is yes. It provides coverage for urgent and emergent care. This is not intended for you to use to see for a preventive visit when you're outside the United States. It's not intended for to have a preventive screening like a mammogram or something like that, or go have your annual physical outside the United States. It's Britt, you're giving me a funny look, maybe because I'm repeating myself. But it's intended for urgent and emergent care when you're outside the United States. So it provides that coverage, but you do have to be a resident of the United States, and it is intended for trips outside the United States, not necessarily, oh, I'm going to live three months of the year in France, anything like that. This probably is not the right plan for you if that's the case, but it does have that coverage for urgent and emergent care. Medicare does not, and that's a good point. Yes, traditional Medicare does not. If you don't have the Medicare Advantage, you still got foreign service when you go overseas, and we pay primary for those claims. If you've got the Medicare Advantage plan, it does have coverage does not exist in traditional Medicare. Great point. Anything else that's we've got several questions, and we'll try to get answers to everybody who's sending questions, even if we can't do it on the air.
So it says, would your weight management program replace something like Weight Watchers, or would it just augment it?
Or what? I'm sorry, what was the last part?
Or would it augment it?
I think Weight Watchers takes a unique approach, and as I understand from friends who are and family members in it, they've just adjusted it again. And so they're constantly looking at this. Our weight management program, and I'll ask any colleagues to jump in with information, but it is providing counseling and guidance. It's not necessarily going to help you assign points to food or something like that. So it may be an augmentation. It's definitely going to have that counseling, whether group or individual component, as well as educational materials. It may provide you with other resources to use to help track calories, help track activity, and so forth. It is going to be comprehensive.
And I'll just add, with the weight management program, it's an individualized program for the individual.
So, and for those online who might not have heard, that Britt was saying that it's an individualized program, our weight management program. It looks at individual needs, maybe other diagnoses you have, medications you're on, things like that, and tailors the program to meet your individual needs. Monique, I think we have time for just a couple more.
It says, can you go over the difference with the acupuncture benefit with the new Medicare plan?
So the difference between the two?
Yes.
Yeah. So I'll speak on FSBP. Britt, I'll turn to you because I have to be careful about questions I answer about the Medicare Advantage. But for acupuncture under the FSBP, our high option plan, it's what it has been for the last several years. You get up to 50 visits per year, and we reimburse up to $60 per visit. Under the Medicare Advantage plan, acupuncture is covered. And does it require medical necessity certification like the massage benefits?
Yes, it's for pain management, but you still have the $0 copay.
Excellent. So it does need to go through that medical necessity review, even within the Medicare Advantage program. Excellent. All right. That's okay. And I think that's going to do it for us today. Again, we got some personal questions. We asked for some follow-up information from folks online. For those of you here in the room, please know we've got some of our resources. Britt will be in the next room to answer questions about Aetna programs as well as the Medicare Advantage. Next to her will be Kelly O'Connell from Express Scripts. Larry Neufeld is also there to answer original Medicare questions. And Kate O'Bear is in there to answer questions about the Senior Living Foundation. We have 2 health benefits officers and 2 members of our ancillary insurance programs team who are here to answer questions about those programs. For those of you online, I will mention that within the On24 platform, you'll see a resources tab on the right side of your screen. You can find the PowerPoints from today in that tab for future reference. We want to stay connected to you, and it's not just us wanting to give information to you. We also want to hear from you. So I want to encourage everybody, please subscribe to our social media channels. We are on LinkedIn, YouTube, Facebook, and Instagram. Please follow us on all of them. Look for other opportunities to learn about programs and to connect with us, including our monthly opportunity to chat live, AFSPA Live, the last Thursday of every month at 11 a.m. We're on LinkedIn, YouTube, and Facebook for that. I'm there. Britt was there 2 months ago, and we've had some fantastic topics recently. Adrian, who's around, joined us this past month. I want to say thank you. I want to say for those online, there is a survey once you close out of the On24 platform. We'd appreciate your feedback and information about how we can improve this and other events in the future. We welcome that feedback in person from those of you who are here in the room. I want to say thank you to Kevin and Claire, also to Darla and Megan, who were not technically able to join us, but they were available. Special thank you to Britt for stepping into the breach. Paula and Mr. Tracy, as always, thank you so much for walking us through what's behind us, what's ahead, and what we're doing to meet those. And thank you to all of you for attending, to the team for making this happen. We hope that you'll join us for future events, including the annual meeting again next year. Thank you, everybody.